Hello, my name is Haley Coolidge, and my chosen profession for this project is nursing. The scope of practice for a nurse depends greatly on which department they are working in and the severity of cases that they are presented with for the day. Aside from these differences, all nurses will provide direct patient care at the bedside, provide emotional support and advice to sick patients, their spouses, and family members. They will also monitor the patient's health, medicine, and diet according to the Bureau of Labor Statistics. A nurse will work under a doctor and follow their orders to best treat the patient. They will also work with a team of other nurses in the same department as them. As a registered nurse, you are able to work in many healthcare settings. These settings include in a community, school, hospital, doctor's office, or in a home care setting. There are some instances where a nurse will work with providing health care to the community outside of a healthcare facility, such as a community center or a school. In these settings, nurses will provide care to students in the schools and people in the community who may not be able to afford care of their own. To become a registered nurse, you must complete an average of 4 years at an accredited university. These 4 years include 2 years of prerequisite classes that is continued by 2 years in a nursing program with clinicals. Once you've completed your Bachelor of Science in Nursing degree, you are eligible to sit for an exam called the NCLEX. Once you pass this exam, then you will be labeled as a registered nurse and can start working in the field at any location of your choosing. The NCLEX certification exam that allows you to be labeled as a registered nurse is a pass or fail exam. You will have a total of 6 hours to complete this exam. However, it may not take you this long to complete. Within the exam, you could have a total of between 75 questions to a maximum of 265 questions. The way the number of questions you will receive is based off of your competency to answer the first 75 questions. However, if you are not able to reach the passing grade within the first 75 questions, you have up until question number 265 or the 6-hour mark. Here I have listed certain nursing organizations at the national and Florida state level. These organizations allow for nurses to have a voice and support them throughout their work. At the national level, there is American Nurses Association, Federal Nurses Association, Academy of Medical Surgical Nurses, and Academy of Neonatal Nurses. At the state level for Florida, there is the Florida Association of Neonatal NPs, Florida Association of Nurse Practitioners, Florida Nurse Practitioner Network, and Florida Nurses Association. In the next 5 years, I plan on applying to an accelerated program around the state of Florida since I will be graduating with my first degree from USF in December. After graduating, I plan on starting and completing one of these programs a year later. After graduating with my Bachelor's of Science in Nursing degree, I will sit for the NCLEX exam and then be able to start working in a hospital. After I gain a few years of experience in other departments in a hospital, I want to eventually end up as a nurse in the neonatal intensive care unit, caring for babies. Here I have listed some of my references that I have used to complete this project. As well as here are the rest of my references. I would like to thank you for your time, and that is the end of my project.